After 70, it's not about how often you bathe, it's about how you do it. And this mistake is more common than you think. 1. Daily baths are not always necessary. As people reach their 70s and beyond, the body goes through natural changes that directly affect how often bathing is truly needed. One of the most important changes happens in the skin. Aging, skin becomes thinner, more fragile, and produces significantly less natural oil sebum than it did in younger years. This oil is essential because it acts as a protective barrier, keeping moisture in and harmful bacteria out. When seniors bathe every single day, especially using hot water and regular soap, this already limited natural oil can be stripped away even faster. Over time, this leads to common problems such as dry skin, itching, flaking, redness, and even painful cracks. These cracks are not just uncomfortable. They can become entry points for infections, which are more difficult for older bodies to fight. Many people believe that daily bathing is required for cleanliness, but medical professionals and dermatologists agree that this is not always true for seniors. For most adults over 70 who are not sweating heavily or exposed to dirt, bathing 2 to 3 times per week is generally sufficient to maintain good hygiene. This approach helps protect the skin while still keeping the body clean. It's also important to understand that cleanliness does not equal frequent bathing. Seniors can remain clean and fresh through simple daily hygiene practices without taking a full shower or bath. Washing the face, hands, underarms, groin area, and feet with warm water and mild soap can effectively prevent odor and bacterial buildup. This method is often referred to as targeted cleansing and is widely recommended for older adults. Another factor to consider is safety. Bathing, especially in slippery bathrooms, increases the risk of falls, one of the most serious health dangers for seniors. Daily showers may unintentionally raise the chances of slips and injuries, particularly for those with balance issues, joint pain, or muscle weakness. Reducing the frequency of full baths can lower this risk while still maintaining hygiene. Climate and lifestyle also play a role. Seniors who live in cooler environments, stay indoors, or have low physical activity levels typically sweat much less than younger adults. In these cases, daily bathing offers a little benefit and may actually cause more harm than good. On the other hand, seniors who live in hot climates or remain physically active may need to bathe slightly more often, but still gently and mindfully. There is also a psychological aspect to consider. For some seniors, daily bathing can feel exhausting, stressful, or uncomfortable due to joint stiffness, fear of falling, or fatigue. Reducing unnecessary bathing can help preserve energy, independence, and overall quality of life. Healthcare providers often emphasize that the goal of hygiene in older age is comfort, skin, health, and safety, not rigid routines. The idea that everyone must bathe daily is largely cultural and not medically required, especially for older adults. In summary, daily baths after age 70 are not a necessity for most seniors. In fact, bathing too often can lead to skin damage, discomfort, and increased safety risks. A balanced approach combining less frequent full baths with daily targeted hygiene is usually the healthiest and safest option. By adjusting bathing habits to match the body's changing needs, seniors can protect their skin, maintain cleanliness, and enjoy better overall well-being as they age. 2. Bathing too often can damage the skin barrier as people age. The skin undergoes significant biological changes that make it far more sensitive than in younger years. One of the most important of these changes involves the skin barrier, the outermost layer of the skin that protects the body from dehydration, bacteria, and environmental irritants. After the age of 70, this protective barrier naturally becomes thinner, weaker, and slower to repair itself. The skin barrier is made up of tightly packed skin cells and natural oils that work together like a shield. These oils produced by the sebaceous glands help seal in moisture and maintain the skin's slightly acidic environment, which prevents harmful bacteria from growing. However, frequent bathing can strip away these essential oils, especially when hot water and regular soaps are used. When seniors bathe too often, the skin does not have enough time to recover between washes. Over time, this leads to a condition known as impaired barrier function. Once the barrier is compromised, moisture escapes more easily, and the skin becomes dry, rough, and prone to cracking. This is why many older adults experience persistent dryness and itching, even when they feel they are doing the right thing by bathing daily. A damaged skin barrier can also cause chronic irritation. Seniors may notice redness, burning sensations, or tightness after bathing. In some cases, excessive washing can trigger or worsen skin conditions, such as eczema, dermatitis, or chronic inflammation. These issues are not only uncomfortable but can significantly affect sleep quality and overall well-being. Another serious concern is infection risk. Small cracks in dry, fragile skin can allow bacteria or fungi to enter the body. Because the immune system also weakens with age, infections take longer to heal and can become more severe. This is especially dangerous for seniors with conditions like diabetes, poor circulation, or compromised immunity. Soap choice plays a major role in skin barrier damage. Many common soaps and body washes contain strong detergents, fragrances, and antibacterial agents that are too harsh for aging skin. These products are designed to remove oil effectively, but for seniors, this often means removing the skin's natural protection entirely. Repeated exposure accelerates dryness and increases sensitivity. Water temperature also matters. Hot water feels soothing, especially for stiff joints, but it is one of the fastest ways to destroy the skin's lipid layer. Hot water dissolves natural oils more quickly than warm water, leaving the skin unprotected immediately after bathing. When bathing happens too frequently, the skin never fully recovers from this repeated oil loss. It's important to understand that clean skin does not require aggressive washing. In older adults, less frequent bathing combined with gentle cleansing methods is usually healthier. Many dermatologists recommend bathing 2 to 3 times per week, using warm water, mild fragrance-free cleansers, and moisturizing immediately afterward to help restore the skin barrier. There is also a hidden cycle that many seniors fall into. Frequent bathing causes dryness. Dryness causes itching. Itching leads to scratching, and scratching further damages the skin barrier. This cycle can continue for months or even years if bathing habits are not adjusted. Protecting the skin barrier is essential for maintaining comfort, mobility, and independence in old age. Healthy skin helps regulate body temperature, prevents infection, and reduces discomfort that can interfere with daily activities. In conclusion, bathing too often after age 70 can unintentionally damage the skin's natural barrier. While cleanliness is important, overwashing can do more harm than good. By reducing bathing frequency, choosing gentle products, avoiding hot water, and allowing the skin time to recover, seniors can preserve their skin barrier and maintain healthier, more comfortable skin throughout aging. 3. Key areas should still be cleaned daily. While full baths or showers do not need to happen every day after the age of 70, daily hygiene is still essential. The key is understanding that cleanliness does not require washing the entire body daily. Instead, focusing on specific areas that are more prone to sweat, bacteria, and odor help seniors stay clean, comfortable, and healthy without damaging the skin. Certain parts of the body naturally accumulate moisture, oils, and bacteria more quickly than others. These areas should be cleaned every day, even on days when a full bath is skipped. The most important areas include the face, underarms, groin area, and feet. These regions are more likely to develop odor, irritation, or infection if not cleaned regularly. The face should be gently washed daily to remove oils, sweat, and environmental particles. Aging facial skin is especially sensitive, so warm water and a mild, fragrance-free cleanser are usually sufficient. Harsh scrubbing or frequent exfoliation should be avoided, as facial skin becomes thinner and more fragile with age. The underarms are another key area. Even seniors who are not physically active still produce sweat, and sweat mixed with bacteria can cause odor and skin irritation. A gentle daily wash helps maintain comfort and confidence. Using mild soap and thoroughly drying the area afterward can also help prevent rashes and fungal growth. The groin area requires daily attention because it is warm and often moist. This makes it a common site for bacterial and fungal infections, especially in seniors with limited mobility, incontinence, or diabetes. Daily cleaning with warm water and a gentle cleanser helps reduce irritation and infection risk. It is important to rinse thoroughly and dry the area completely to avoid trapping moisture. The feet are often overlooked, but are especially important to clean daily. Feet are enclosed in socks and shoes for long periods, creating a warm environment where bacteria and fungi thrive. Seniors are also more prone to foot problems due to reduced circulation, nerve sensitivity, and slower healing. Daily foot washing Careful drying between the toes and regular inspection can help prevent infections, sores, and complications. Hands should also be washed regularly throughout the day, especially before eating and after using the bathroom. While this may seem obvious, hand hygiene becomes even more critical with age because older immune systems are less effective at fighting infections. This approach to hygiene is often called partial bathing or targeted cleansing. It allows seniors to stay clean without overexposing the skin to water and soap. Targeted cleansing is especially helpful for those who experience fatigue, joint pain, balance issues, or fear of slipping in the bathroom. Daily cleaning of key areas also supports skin health and comfort. When sweat, bacteria, and moisture are removed regularly, there is less itching, irritation, and odor. This can improve sleep quality, mobility, and overall confidence. Another benefit of daily targeted hygiene is early problem detection. When seniors clean these areas regularly, they are more likely to notice changes such as redness, sores, swelling, or unusual odors. Early detection allows for quicker treatment and helps prevent small issues from becoming serious health problems. It's important to use the right products. Mild, fragrance-free cleansers are best, and antibacterial soaps should generally be avoided, unless recommended by a healthcare provider. Warm water, not hot, should be used to protect sensitive skin. After cleaning, gently pat the skin dry rather than rubbing, which can cause irritation. In summary, while daily full-body bathing is often unnecessary after age 70, daily cleaning of key areas remains essential. This balanced approach protects the skin barrier, reduces infection risk, improves comfort, and helps seniors maintain dignity and independence. By focusing on the areas that need attention most, seniors can stay clean and healthy without the downsides of overbathing. 4. Health conditions affect how often seniors should bathe. There is no single bathing schedule that works for every senior. After the age of 70, individual health conditions play a major role in determining how often bathing is necessary and safe. What may be appropriate for one older adult could be uncomfortable or even harmful for another. Understanding how medical conditions affect bathing needs helps seniors maintain hygiene while protecting their health and safety. One of the most important factors is mobility and physical strength. Seniors with arthritis, muscle weakness, balance problems, or joint stiffness may find bathing physically demanding. Standing for long periods, stepping into a tub, or maintaining balance on wet surfaces increases the risk of falls. For these individuals, bathing less frequently but more safely using seated showers, grab bars, or assisted bathing may be a better option than daily showers. Skin-related conditions also influence bathing frequency. Seniors with eczema, chronic dryness, dermatitis, or fragile skin often experience worsening symptoms when they bathe too often. Frequent exposure to water and soap can intensify itching, inflammation, and skin breakdown. In these cases, healthcare providers often recommend fewer full baths, combined with daily targeted cleansing and regular moisturizing to protect the skin barrier. Chronic illnesses, such as diabetes, require special consideration. People with diabetes are more vulnerable to skin infections, slow wound healing, and foot problems. While cleanliness is important, excessive bathing can dry the skin and increase the risk of cracks that lead to infection. Diabetic seniors may benefit from gentle bathing routines, careful foot hygiene, and avoiding harsh soaps or hot water. Incontinence is another condition that may affect bathing frequency. Seniors who experience urinary or bowel incontinence may need more frequent cleaning to maintain comfort and prevent skin irritation or infection. However, this does not always mean full baths every time. Often, localized cleaning and proper skincare products can effectively manage hygiene while avoiding the strain and skin damage caused by frequent full-body bathing. Respiratory and heart conditions can also make bathing more challenging. Warm, steamy bathrooms may cause shortness of breath or dizziness in seniors with heart disease, chronic obstructive pulmonary disease (COPD), or low blood pressure. For these individuals, shorter baths, cooler water temperatures, or less frequent bathing may be safer. Sitting while bathing and ensuring proper ventilation can also reduce strain on the heart and lungs. Cognitive conditions such as dementia or Alzheimer's disease may change how often a senior can safely bathe. Confusion, fear, or agitation can make bathing stressful or unsafe. In these situations, caregivers often adapt bathing schedules to the senior's comfort level, focusing on cleanliness rather than rigid routines. Gentle encouragement, familiar routines, and shorter bathing sessions can make a significant difference. Mental health also matters. Seniors experiencing depression or anxiety may lack the energy or motivation for frequent bathing. Forcing strict bathing routines can increase stress and resistance. A flexible approach that prioritizes comfort, dignity, and gradual engagement is often more effective and supportive. Environmental factors linked to health should also be considered. Seniors living in hot climates or those who remain physically active may sweat more and need to bathe slightly more often. Conversely, seniors who are mostly sedentary or live in cooler environments may not require frequent full baths. Healthcare professionals emphasize that bathing should support health, not challenge it. Doctors and caregivers often recommend tailoring bathing routines to each senior's medical needs, abilities, and lifestyle. There is no medical requirement for daily bathing if it compromises safety, skin health, or overall well-being. In summary, health conditions significantly influence how often seniors should bathe. Mobility limitations, chronic illness, skin conditions, incontinence, heart or lung disease, and cognitive health all play a role. The healthiest approach is a personalized bathing routine that balances cleanliness with safety, comfort, and skin protection. By adjusting bathing habits to match individual health needs, seniors can maintain dignity, reduce risk, and support better quality of life as they age. 5. How you bathe matters more than how often when it comes to bathing after the age of 70. The way you bathe is often more important than how frequently you do it. Many skin problems, injuries, and discomforts experienced by seniors are not caused by bathing too little, but by bathing in ways that are too harsh, unsafe, or poorly suited to aging bodies. A gentle, thoughtful bathing routine can protect skin health, reduce fall risk, and greatly improve comfort and well-being. One of the most critical factors is water temperature. Hot water may feel soothing, especially for stiff joints or sore muscles, but it is one of the fastest ways to strip the skin of its natural oils. Aging skin already produces less oil, and hot water accelerates dryness, itching, and irritation. For seniors, warm water, not hot, is the safest and healthiest choice. It cleans effectively without damaging the skin barrier. Bathing time also matters. Long showers or baths expose the skin to water for extended periods, increasing moisture loss. Once the skin dries, dermatologists often recommend keeping baths or showers short, about 5 to 10 minutes. Shorter bathing times reduce dryness, while still allowing for proper cleansing. The type of soap or cleanser used is equally important. Many commercial soaps contain strong detergents, fragrances, and antibacterial agents that are too harsh for older skin. These products remove dirt, but they also remove protective oils. Seniors benefit most from mild, fragrance-free cleansers designed for sensitive or dry skin. Using soap only where it's needed, such as underarms, groin, and feet, can further reduce irritation. How the skin is dried after bathing is another overlooked detail. Rubbing the skin aggressively with a towel can cause micro tears and irritation, especially on thin, fragile skin. Instead, seniors should gently pat the skin dry, leaving it slightly damp. This method prepares the skin for moisturizing and reduces irritation. Applying moisturizer immediately after bathing is one of the most effective ways to protect aging skin. Within a few minutes of stepping out of the bath or shower, a fragrance-free moisturizer helps lock in moisture and restore the skin barrier. This step is especially important for seniors who experience dryness, itching, or cracking. Safety in the bathroom is just as important as skincare. Bathrooms are one of the most dangerous places in the home for older adults due to slippery surfaces and limited balance. Using non-slip mats, grab bars, shower chairs, and handheld shower heads can greatly reduce the risk of falls. Seniors should never rush while bathing and should ensure the bathroom is well lit and properly ventilated. Posture and body positioning also affect safety and comfort. Standing for long periods can cause dizziness or fatigue, especially in seniors with heart conditions or low blood pressure. Sit-in while bathing can reduce strain and make the experience more relaxing and controlled. Another important consideration is listening to the body. If bathing leaves a senior feeling dizzy, exhausted, itchy, or uncomfortable, it's a sign that the routine needs adjustment. Small changes, cooler water, shorter time, gentler products can make a significant difference. It's also helpful to recognize that bathing does not have to follow strict rules. Some seniors feel best bathing in the morning, while others prefer evenings. The best routine is one that fits comfortably into daily life without causing stress or fatigue. Healthcare providers consistently emphasize that gentle, safe bathing supports long-term health. While harsh routines can create ongoing problems, the goal is not to bathe as often as possible, but to bathe in a way that preserves skin integrity, prevents injury, and maintains comfort. In conclusion, for seniors over 70, how you bathe truly matters more than how often you bathe. Warm water, short bathing times, gentle cleansers, prepared drying, immediate moisturizing, and strong safety measures all play a crucial role. By focusing on quality rather than frequency, seniors can maintain cleanliness, protect their skin, and enjoy bathing as a safe and comfortable part of daily life.